The new year has just begun, and in Quebec already, the province's emergency rooms are facing an overcrowding crisis. In Montreal, the ER occupancy rate surged to 145% as of noon yesterday. Now, to help alleviate the strain, healthcare officials there are asking people with respiratory viruses like the flu or COVID-19 to stay at home if they can. CBC's Melissa Francois with more.
Emergency rooms in Quebec are overcrowded after a short reprieve during Christmas. In Montreal, the situation is particularly bad. Medical staff are treating people for respiratory viruses, and some patients appear to be eating and drinking their way into the ER. At the Montreal General Hospital, the Verdun Hospital, and the Lakeshore, the occupancy rates were hovering at or just over 200%.
The occupancy rate does not always reflect all the patients that are in the emergency department. It reflects the number of people that are on a stretcher, either in investigation or waiting to get a ward bed. But the number of people in the emergency department is sometimes a lot more than that.
Respiratory viruses like the seasonal flu and COVID-19 are circulating. I'm currently sick. I have a cold, she says. However, this lady says she's lucky.
Non, pas de virus.
Nobody went to the hospital in her family. Pediatrician and microbiologist at Montreal's Children's Hospital, Jessie Papenberg, warns the influenza season is just around the corner.
And what that means is that for those of us who may not have yet had the chance to get vaccinated for influenza this year, there still is time to protect oneself for the worst of the season.
Another reason people are visiting the ER? Some are overindulging during the holidays.
We see a lot of intoxications and a lot of food poisoning issues with people that have eaten a little bit too much and challenged their gallbladder. So we see a lot of what we call biliary colic or gallbladder crisis. We see people overeating, overdrinking, sometimes not sleeping enough. So there's a lot of things to do with prevention.
She encourages those with non-urgent health issues to go to the pharmacy or call the 811 hotline. According to the latest data, people are spending on average 5 hours in the waiting room. It goes up to 17 hours if they're on stretchers. Melissa Francois, CBC News, Montreal.